Hi, my name is Andrea. I'm the co-owner of the Ketamine Infusion Clinic in Bel Air. We're opening in January, and I wanted to give you a little video to discuss what it is that we do. Ketamine has been a long-standing anesthetic. It's very well known for its analgesic properties. Different from other pain meds is it maintains your respiratory drive, and it supports your cardiac system when it needs support. About 20 years ago, they started studying ketamine because they were noticing that when given to certain people, it had other effects that were unintended, such as the remediation of suicidal ideations, the feeling of depressed patients and feeling better. So, because ketamine has been branded for a long time, pharmaceutical companies really have no interest in paying for big studies. So all the studies that have been done by practitioners who have seen the effects and wanted to study how good they actually are. And the studies are astounding. Over 13 million people every year seek treatment for depression, bipolar disorder, PTSD. Over 30% of them have tried 7 and 8 different medications and have never found relief. Most of them still taking multiple medications that affect their activities of daily living. Ketamine in this population has a 70% effective rate. That means that 70% of those people find relief that they've never had before. That's an amazing statistic. It immediately reverses suicidal ideations in a patient that is suicidal. There are countless videos online of patients telling you what it has done in their life. And I just ask that if you have questions, you let us know. A lot of people hear ketamine and think, oh, that's a street drug. It is. Unfortunately, people will abuse any medicine they can. However, it has absolutely zero physical addiction properties. It's why it is such an important medicine in anesthesia, especially now that we are trying to go to a non-narcotic technique because of the narcotic addiction issue in the United States. Ketamine is becoming a mainstay once again. There's zero addiction potential physically. If anybody wants to abuse ketamine, again, it's done by choice, not because they crave it. There's no withdrawal. As a matter of fact, it is used for withdrawal from opiates as it helps people withdraw. At this time, we're not using it for that in our clinic. However, addicts of drugs or alcohol almost always have a dual diagnosis. They have an underlying disorder that either was never treated or never responded to traditional medications, like depression, PTSD, bipolar disorder. By treating those underlying disorders, we decrease their chance of using drugs and alcohol to self-medicate once again. We're excited to open in January. We're excited to bring this treatment to you. We've seen what it can do in patients, and it's nothing short of amazing. I ask that you like our page, that you ask us questions, and you share our information. Thank you so much. Merry Christmas.